Welcome to the Plain English Public Health Weekly Report. I'm Richard Greenland and today is July 17th, 2020. As always, we start with our COVID-19 statistics. Right now worldwide we have more than 14 million cases and nearly 600,000 deaths. In the United States, we currently have over 3.7 million cases and about 142,000 deaths. We're going to get started this week by touching on a few of the things we talked about last week. First, the reopening of schools. Internal CDC documents have been uncovered that describe the high risk of reopening schools. Apparently, the CDC is quite worried that the number of new cases will increase dramatically once schools are reopened in the fall. And that was the driving force behind those stringent guidelines that we talked about last week. The American Academy of Pediatrics, which had previously stated that schools should reopen in the fall, has now released another statement clarifying their stance. They now emphasize that school reopening should be based on science and safety, not politics, which is basically what we said last week. Reopening schools everywhere in the United States, all of them a blanket reopening or being forced to reopen or not have funding would be completely unwise, just because individual school districts face different challenges. They have different levels of COVID-19 infection in each area, and so the individual school districts should be the ones to make those decisions. Masks are still at the forefront of the COVID-19 news this week, so we'll talk a bit more about that. We did already talk quite a bit about this last week and the week before, so if you want more information than what you get from this week, please go back and view those prior reports. So first off, last week we did overlook one major reason why masks are able to block virus particles that by all means should be able to go through masks just based on their size. But that reason that we overlooked is that there's an electrostatic charge that builds up within mask materials. We mentioned a few weeks ago that a cloth mask made of 2 layers of chiffon fabric and 1 layer of cotton seems to be the best option for increasing the electrostatic charge. While that seems to still be true, that's still the best option for cloth masks, studies have shown that nearly all fabrics, including those used in surgical masks and N95 masks, do produce enough of an electrostatic charge that they are going to attract those virus particles as they go through the mask. So that makes it that even masks that really should be allowing those particles through based just on size are actually stopping many of those particles because they grab the particles as they go through instead of just letting them slide through just by themselves. Also, a new type of mask is in development by MIT and Brigham and Women's Hospital. They've already created quite a few of these, but they're still in testing and they're trying to make them even better. These new masks are made mostly of silicone rubber, and they also have places to insert some N95 filters. The materials make the mask fit well, and they also make it very easy to clean. The N95 filter material that's used is much less than what would be used in a normal full N95 mask, and yet it still works just as well for filtering. The mask is also made using injection molding techniques, which is something that's easily available in pretty much any of the manufacturing industries, and so it would be very easy to produce a lot of these masks really quickly. And so that could be a real game changer for healthcare workers to have these masks available. We wouldn't have to rely so much on the current N95 masks, which are actually pretty difficult to make, or at least they take quite a while to make, and to get them to work right, and they're not reusable either. Many businesses across the United States have now declared that they are going to be either requiring masks now or within the next month in order to go into those businesses. Some of the notable names there are Walmart, Sam's Club, Target, Kroger, and Best Buy. They join many others who have already been requiring masks for a while, such as Costco. Even President Trump wore a mask this week when he visited the Walter Reed National Military Medical Center. This underscores the importance of masks because President Trump has in the past been very anti-mask, so even he's wearing a mask now. There's been a lot more discussion about masks this past week, and it just keeps on continuing to be a controversial point, but something that we keep doing more studies, keep finding more information on. There's just so much information about masks. We can't talk about all of it here in the time we have for this weekly report, but I have included a bunch of links down below in the video description, so please feel free to check out those links to get more information. The warning about hand sanitizers that we have had for the last couple of weeks, due to the methanol content of those hand sanitizers, that's been expanded again this week. There are now way too many brands of hand sanitizer to put on the screen, and so I'm just going to go ahead and put a link down in the description. Please follow that. See if you have any of those brands that are known to have methanol. Again, like I mentioned last week, the major name brands typically are going to be safe, whereas a lot of the newer types, the newer brands that are just cropping up, taking advantage of the need for the hand sanitizer, they're the ones that are typically not as trustworthy and more likely to have the methanol. So just please be careful with that. A new unknown pneumonia is what they're calling it right now, is circulating in Kazakhstan. We don't yet have much information about it. It seems to have a higher death rate than COVID-19 does, but at this point we have so little information that it may just be another outbreak of COVID-19 that maybe hit a more vulnerable population or something, so it has a higher death rate. We just don't know at this point. There have been very few reports of it. And so we're going to continue to follow that, and we'll let you know if there's any more information on that in the coming weeks, if it ends up not being COVID-19. So focusing again on this COVID-19, the CDC has added more symptoms to the official list of symptoms. They've added runny nose and nausea to that list. The full list of symptoms is on the screen right now, but you can also find those in a link in the video description. Many people don't experience any symptoms after catching COVID-19, but those who do experience symptoms usually will start to experience it as early as 2 days after exposure to as late as 14 days after exposure. Of course, symptoms can last much longer than those 14 days or 2 weeks once you start experiencing those symptoms. But the initial time to start showing those symptoms is typically between 2 to 14 days. Also, it's important to note that people are considered contagious after, 2 days after exposure. Whether you show symptoms or not, you can still pass it to other people if you have COVID-19. So, as we've said many times in past reports, it's very important that whether you show symptoms or not, whether you feel good, feel sick, whatever, you need to be wearing that mask when you go out in public to protect other people. Again, masks are not so much for protecting yourself as they are for protecting other people, so we all need to do it. There have been many reports in the past couple of weeks of gatherings ending in lots of new COVID-19 cases and sometimes even deaths. One in particular involved a COVID party where a bunch of people got together down in Texas with a person that was a confirmed case of COVID-19 in order to see who would get sick or who would get it. Apparently they didn't believe that anyone could actually get this or that it was even real. They believed that this person that was a confirmed case just had some other illness or whatever and didn't care. The party resulted in a number of new cases and one death. Just before that person died, he told the nurse, "I think I made a mistake. I thought this was a hoax, but it's not." A record number of cases were also reported in Tulsa, Oklahoma, just weeks after President Trump had one of his rallies there. In that rally, many people were not wearing masks. They were not following social distancing protocols. There were also a number of other gatherings in Tulsa around that time, not just the rally for President Trump, but now we're seeing a large increase of cases due to those activities during that time. There are many other reports of increasing cases throughout the United States. In fact, only 3 states are reporting a decrease in new cases, but I will just include links to some of the stories about those increasing cases down below. Right now, there is so much evidence that COVID-19 is real and dangerous that anyone who still believes COVID-19 is a hoax is either in denial or just really doesn't know how to separate fact from fiction. We understand that there's a lot of information out there that's conflicting. We understand that sources that you've trusted for other news, whether it's political or other things, those sources that you've trusted for that are now saying different things. Right now, we need to make sure that we are listening to those sources that know what they're talking about. Basically, what that means is listen to the scientists. Right now, the CDC, the Centers for Disease Control, is the number one source of accurate information in the United States about COVID-19. If you see a story and it goes against what the Centers for Disease Control has already said, chances are it's not accurate. Again, it might be something that's brand new that the CDC just hasn't addressed yet, but that's less likely than it just being something completely inaccurate. Some of these, some of this information may just be, inaccurate, at best, but other information that is being thrown around out there is quite dangerous. In fact, some of it is put out there in order to cause problems. We don't want to be listening to that information. Please get your information from those that actually know what they're talking about. This is a case where we need to listen to the science. There's just so much that can be learned by listening to the right sources of information. We do have some good news about COVID-19 this week, thankfully. The vaccine that the company Moderna is making in conjunction with the National Institutes of Health has so far been successful. So far, they've gone through a number of phases, and the phases to this point have been in order to determine if it creates antibodies in a human. And so far, that's been happening. It's been great. As far as we can tell, it seems to work great. They're entering the final phase of their trials. This final phase will have about 30,000 people who have volunteered, so much larger than any of the other phases. And this phase actually goes in to test specifically whether this vaccine will keep people from getting COVID-19. That's one of those big unknowns that we just haven't been able to answer yet. Whether having it before and getting those antibodies, or even getting a vaccine, will keep people from getting it in the future, and for how long they'll be immune, if they are immune at all. And also, it will test to make sure that it is safe for all different types of people. So far, the tests have only been focusing on those that are already healthy, fairly young, basically those that are not at high risk. This final phase will also test in those that are older, those that have known immune conditions, things like that, so that we can know for sure if it really is safe for the majority of the population. There are other vaccine trials throughout the world that are also getting close to this same phase. So lots of good news there. Hopefully that vaccine will help us and will let us get over this virus for once and for all. In non-COVID-19 news, the FCC has decided that the new National Suicide Prevention Hotline number will be 988. The 3-digit number will be much easier to remember than the current 10-digit number. And so that should help out a lot of people who are having suicidal thoughts, depression, things like that can be helped with that suicide prevention hotline. That does not take effect until July 2022, however. So until that time, please continue to use the current hotline. That hotline number is 1-800-273-TALK, T-A-L-K, which is 8255 on your phone. Also, new studies show that alcohol is even more useless and more dangerous than previously thought. The current recommendations are for men to have no more than 2 drinks per day and women to have no more than 1 drink per day in order to be more healthy. New research indicates that there really is no difference between men and women as far as alcohol intake is concerned. And so they say both men and women should have no more than 1 alcoholic drink a day. The researchers stressed strongly that this does not mean that you can go the entire week without drinking anything and then binge on the weekend and use up all your dailies on the weekend. That's not how this works. That's a recipe for disaster, actually. They also were quick to point out that this is not a recommendation to drink up to 1 drink a day. This is an upper limit. They said that it's still important to realize that not drinking alcoholic drinks at all is still the best thing for your health. If you haven't drank, or if you're not drinking now, don't start. In the past, there have been some studies that have shown that alcohol does provide some benefits for your health, but studies done since then have shown that even though there may be some benefits, the negative consequences far outweigh those positive benefits, and you can get all those positive benefits you can get from alcohol through other healthier and safer foods and drinks. So please, stay away from alcohol. It just isn't worth it. Thank you for watching Plain English Public Health Weekly Report for July 17th, 2020. I'm Richard Greenland, and you have a healthy and non-alcoholic weekend.